Hello, everyone. I hope you can hear me. Um, Before we begin, I wish to acknowledge the support of the interpreters, Claudia Acevedo for French, Carmelo Velázquez for Spanish, and Rashid Mtugi for Arabic. Next slide, please. All right, so good morning or good afternoon to everyone, depending on where you're joining us from. Thank you for being with us today. I'm Dima. I'm the coordinator of the Infant Feeding in Emergencies core group, and I'll be introducing today's webinar, which is on the topic of supporting wet nursing in emergency contexts. This webinar will be recorded so that we can share the recording with anyone who wasn't able to attend, and it's in process already. Please introduce yourself in the chat, who you are, where you're listening in from, so that we all know who we all are. And on to just some housekeeping rules. Please, if you can keep your mics and cameras off to save on bandwidth, that would be great. If you do have any questions about the presentation or that you would like to bring to our presenters, please put them in the Q&A box and let us know who the question is for if you'd like. And that is just that Q&A box is next to the globe icon at the bottom of your screen. If you do have any other general questions or comments, you can put these in the chat. So we'll ensure to take time throughout the webinar to answer your questions. And if there are any outstanding ones, they'll be answered in the Q&A session of our webinar. And if we do run out of time, unanswered questions will be responded to and shared after the webinar. Next slide. So this webinar is organized jointly by the Global Nutrition Cluster and the Infant Feeding in Emergencies core group. On this slide are the logos of all the member organizations of the IFE core group webinar working group, as well as our donors, without whom we would not have been able to deliver this webinar. I'd like also here to take the opportunity to extend our thanks to our colleagues Miriam Yanakis from the Global Nutrition Cluster and Holly Roughhead from the Emergency Nutrition Network for all the technical support they've provided to make this webinar work. Next slide, please. A quick overview of the Infant Feeding in Emergencies core group. This is a global collaboration of agencies and individuals committed to the protection, promotion, and support of appropriate infant and young child feeding in emergencies, also known as IYCFE. It was established in 1999 to respond to concerns and gaps related to IYCFE, and is dedicated to ensuring more effective IYCFE support in emergency contexts by strengthening learning, guidance and policies, planning and capacity in IYCFE. On this slide, you'll find this QR code will take you to the key resources on IYCFE produced by the Infant Feeding in Emergencies core group. So next slide, please. As some of you might know, so global recommendations have emphasized the role that wet nursing, donor human milk, milk banking, and lactation may have in emergencies as safe alternatives when breastfeeding from the biological mother is not possible. However, gaps in guidance and programmatic recommendations related to wet nursing in emergency contexts were identified, and those were limiting efforts to promote and support this practice, especially in contexts where it could be acceptable and practiced by the communities. So we hope that today's webinar will help us answer the following questions. What practitioners, breastfeeding counselors, emergency responders, health and nutrition managers, programmers, and policymakers need to support wet nursing? What are the barriers and facilitators based on their experience? And what else needs to be done so we can support wet nursing? And how will the upcoming guidance help in our work setting? So next slide. The agenda for today's webinar will include presentation by UNICEF, which will highlight sections of the new upcoming guidance on wet nursing in emergencies, and that will be followed by a presentation by Arugan on their experience in supporting wet nursing in emergencies in the Philippines. We will then join an interactive session and initiate a conversation on how to disseminate and put the new guidance to practice. And we'll follow with questions and answers, and finally proceed with the closing and evaluation of the webinar. Next slide, please. So this webinar has involved about 13 speakers and facilitators from organizations, agencies, and countries, and all listed on this slide. In terms of presenters, we will hear from Alex Yayamo today, Senior Emergency Nutrition Advisor at FHI 360, Fatmata Sisay, Nutrition Specialist, Infant Feeding at UNICEF, Ma Ines Fernandez, Executive Director and co-founder of Arugan in the Philippines, and also IPFAN Southeast Asia representative. We'll hear from Dr. Bindi Borg, independent IYCF practitioner and researcher, Isabel Morigel, independent IYCFE specialist and consultant with UNICEF, and Peggy Konigsbuer, independent senior advisor, nutrition and SPCC. You will also find the names of facilitators as well behind the scenes in the chats and the Q&A as well from many of us today. So without further ado, I will now hand over to Fatmata and Isabel for the presentation from UNICEF. Thank you. Next slide.
Thank you so much, Dima, for that introduction. Colleagues, welcome all again. Today, we are excited to share with you insights into the new operational and technical guidance on supporting wet nursing in emergency settings, which was developed by UNICEF and the IFE core group. So for today's session, we will explore why and how this guidance was developed, its global significance, and what you can expect to find inside the document. So to get you excited. We will also highlight some key next steps in terms of its finalization and dissemination. Next slide, please. Next. So the need for a clear guidance on wet nursing became evidence as we face increasing emergencies globally where infants' access to safe and nutritious infant feeding options are compromised. This guidance really aims to address these critical gaps, ensuring that every infant has the potential for a healthy start in life, even during emergencies. As we all know, wet nursing is not just a historical practice, but it's also a life-saving intervention today. And then it's also very important to operationalize global guidance and standards, as well as recommendations that support wet nursing in emergency settings, especially for infants who do not have access to their mother's own milk. Next slide, please. So just to give a brief highlight here about why we are doing all this, we all know the importance of breastfeeding in emergencies is well established. Infants and young children, we know, are vulnerable, especially regarding their feeding, and the younger the child, the more at risk they are in emergency settings. And breastfeeding offers protection against several of the most significant risks faced in emergency settings. And these are all very well documented. And if you want to ask, what's really the feasibility of wet nursing compared to other methods? We all know that wet nursing confers many of the same protections as maternal breastfeeding, and in most situations, is safer compared to using BMS in emergency settings. And wet nursing can be valuable and more feasible infant feeding option during emergencies compared to other feeding options, such as express breast milk, which requires appropriate storage and transportation and can be problematic in emergency settings, relactation, which we all know takes time. Of course, it can be fairly straightforward for some women, but for others, it may require intensive skill support. And then human milk banking, we all know requires a lot of processes, including hygienic handling. And then, of course, BMS, I don't need to re-emphasize, can be a last resort for non-breastfed infants, but sometimes it comes with a baggage of issues. So in terms of the wider benefits of supporting wet nursing at scale, we know that supporting wet nursing is important because it also strengthens breastfeeding advocacy, building community resilience, enhancing mental health and psychosocial well-being, as well as empowering women. Next slide, please. So just to reiterate and assure us all that our guidance aligns with UNICEF and WHO global standards and the IFE core group operational guidelines, which support the use of wet nursing when an infant cannot be breastfed by their own mother. The IFE core group's operational guidance on infant feeding in emergency really directs respondents to intervene to protect and support infants and children who are not breastfed to meet the nutritional needs and minimize the risks. It clearly states that when an infant is not being breastfed, we should explore in priority order the viability of free lactation, wet nursing, donor human milk, all of this informed by cultural context, acceptability by the mothers, and availability. And then BMS is a last resort, which can be provided accompanied by an essential package. There are also other additional guidelines that support this. You know, the directive to support wet nursing during emergencies is also echoed by the SPARE minimum standard for humanitarian action, as well as the UNICEF WHO 2018 operational guidance on HIV and infant feeding in emergencies. And even recently in the COVID pandemic, WHO recommended wet nursing as an alternative feeding method for infants whose mothers confirmed or suspected to have COVID and could not be breastfed. And it will also excite you to note that more recently, wet nursing is strongly recommended by WHO within the management of severe wasting for infants less than 6 months of age. So in summary, the recommended first option to explore for infants currently not receiving mother's own milk is free lactation and then wet nursing and feeding with other women's express breast milk. Next slide, please. Just to wrap it up on the rationale, we all know the importance of breastfeeding in emergency settings. It can mean life and death for most infants in emergencies. And this includes wet nursing, which is basically breastfeeding someone else's child. And throughout history, we know women have provided breast milk through wet nursing to ensure the survival of infants. But however, support for wet nursing is often overlooked in emergency response plans and national guidelines. So in 2019, a report came out from Save the Children through the Rohingya response in Bangladesh, stating clearly that support to the non-breastfed child through wet nursing and lactation were being challenged by a lack of relevant operational guidelines. And this was also re-emphasized in a review and recommendations, which were summarized in a field exchange report in 2019. Then this also came up in a request by many partners who were providing support in the Ukraine response. So really to safeguard the health survival of one of the most vulnerable groups in emergencies, there was a need, a call for UNICEF and partners to step up and provide guidance and support to help support practitioners implement international recommendations on wet nursing. So at this stage, I will now hand over to Isabel, who will take us through the meat of all of this, the guidance development process, and the key content. Over to you, Isabel.
Thank you so much, Fatmata. So the operational guidance on infant and young child feeding in emergencies instructs us to assess the feasibility and the cultural acceptability of wet nursing at the start of an emergency. But how exactly should we do that? And should wet nursing programming even be considered for an emergency affected population practicing Islam and milk kinship? And what about if the HIV prevalence is really high? So these are some of the common questions which we set out to answer with the guidance. Hello, everyone. It's a pleasure to be here with all of you and to share more about this guidance that I have spent the past year or more working on together with our technical advisory group, many of the members whom are with us today. So I'll start by sharing a little bit about how we developed the guidance and then giving you a sneak preview of what to expect from the guidance. And our aim was really to develop a very thorough understanding of this practice of breastfeeding someone else's infant and how best this potentially life-saving practice can be supported during emergencies around the world. So to start with, we examined over 80 publications, both peer-reviewed and grey literature, looking at both emergency and non-emergency contexts, both current practices and looking at this long and diverse history that this practice has. And to make sure that we were learning from real-world examples, we developed a case study template which covered the main programmatic aspects from the guidance. And we received 3 submissions which highlighted really diverse experiences, from the Rohingya response in Cox's Bazar to the breastfeeding of an opioid-exposed infant in kinship care within an Indigenous community in Canada. And these new case studies that we received were complemented by plenty of existing case studies, which we found in the literature. Given the diversity of this practice, getting very diverse perspectives was also really crucial to developing our understanding. So in addition to the expert insights which were provided by the TAG, who guided me throughout this process to this day, I also interviewed practitioners from all around the world. And 2 of our TAG members, Bindi and Alessandro, who are with us today, they conducted a rapid evidence review, which compared the risks and the protective factors of this practice for the nursling and for the breastfeeding woman to other alternative infant feeding methods. And I will touch on the findings from this review shortly. And last, but certainly not least, we dedicated our attention to very carefully considering terminology. If you are listening to this presentation in English, depending on your culture and your country's history, you might find the use of the English term wet nursing inappropriate or even offensive. I wanted to recognize that today and to apologize if that's the case. It is the reason that you may notice me using descriptive language at times instead of using wet nursing during the presentation. And this kind of modeling of alternatives we've also used within the guidance. So recognizing that language evolves over time and understanding that there are negative connotations historically associated with the term wet nursing in some locations and in some cultures, we took the concerns that were raised by several TAG members very seriously. And I subsequently involved all TAG members in an in-depth consultation. We discussed it further with various key informants we interviewed, and in the hope of finding an alternative that would be suitable for use within global guidance, I also conducted an additional desk review which focused specifically on terminology. Unfortunately, no alternative was found that is really widely used and understood. So it is really my hope that this will change in the future. I have no doubt that this conversation is not finished, but for the purposes of this guidance, we really needed to direct our attention back to developing this urgently needed guidance and not getting stuck on wording. But in the guidance, we have included a note on language, which really highlights the importance of being aware of any potential sensitivities and of identifying contextually appropriate terms that are locally used and understood and accepted. Thank you. Next slide, please. I wanted to share a little bit about our experiences and findings from developing the guidance. One of the key challenges was that there is very little written about the modern day practice of breastfeeding another family's infant. There is an abundance of literature on its history, but very few experiences document in detail supporting this practice, especially in emergencies. I found a handful of publications, which I've included on the slide for you here. And I also didn't find much guidance or guidelines, also not for non-emergency settings. So although there are very important differences to be aware of, we also included guidance on human milk banking and informal milk sharing within the desk review of these 80 or more publications. Also, another limitation we ran into was that within the existing literature, there is really an overwhelming predominance of Western perspectives and Western histories. So to ensure a more inclusive approach, we actively engage practitioners from diverse cultures, including Indigenous communities, in the tag and in the interviews. Another challenge when it comes to wet nursing compared to regular breastfeeding counseling of a mum and her baby is that suddenly there are a lot more parties to consider. We have the infant being breastfed, their family, the woman who is breastfeeding the infant, potentially any of her own children. So recognizing and protecting each group's needs and rights became essential for shaping this guidance. And yet, while navigating these complexities, we needed to remember that this practice is as old as humankind. It often occurs spontaneously without any external assistance, and it offers a local and rapid solution which can save lives. So our mission was to create guidance that's both practical and accessible, trying to strike the balance between the need for protocols and safeguards for emergency programs and the natural simplicity of this practice. And to end on a positive note, we discovered that wet nursing is far more commonly practiced and accepted than is often assumed by emergency responders. A bit more on that now. Next slide, please. In terms of history, our desk review found that this is really an ancient practice. It's not new, it's not a modern invention. And there are various kinds of wet nursing which have existed in human cultures and religions across time. But in some cultures, it was institutionalized, professionalized, and it became a coercive and exploitative practice with really tragic consequences, which we must take great care to learn and to not repeat. It is very important for emergency responders to be aware of both their own cultures and history and that of the population they're supporting if they're not the same. And for any international responders, taking care not to impose their own biases and potentially negative perspectives on cultures which have a positive history. And this diversity persists today. So to quote Virginia Thorley, as a normal part of women's lives in an emergency or for convenience, it has largely been unrecorded, and so it is not possible to calculate its prevalence. Often, it's only publicized when there's something unusual. So you can see the screenshots from the different newspaper articles to illustrate this. But although we don't know the prevalence, we do know that this practice occurs in most cultures around the world. An analysis by Hewlett and Wynne found that, in fact, it occurs in 93% of the 107 cultures that they examined. And when it occurs, it's most often as a compassionate response to a personal crisis. So, for example, a mother has died or become separated from her infant. It's quite rare for it to be the normative way of feeding infants within a culture, and it's equally rare for it to be completely forbidden under any circumstances. So as you can imagine, such personal crises, maternal death, severe illness occur more commonly during emergencies. And as the focus really shifts to saving lives, we often see that wet nursing and related practices such as relactation and informal milk sharing become more accepted and more commonly practiced. I will now briefly share one such example from Ukraine. I won't go through everything, but direct you instead to the recent case study on this, on lessons learned from the Ukraine response. But what to point out was that pre-crisis interest was quite low. And I was one of those who was involved in the initial international response. And wet nursing was left out from the international guidance, including the joint statement, because there was a fear that it wasn't culturally accepted, that it wouldn't be suitable because of the high HIV prevalence. And so it was left out. But in fact, it did occur. A notable case was from Mariupol, during the besiegement, where breastfeeding women were viewed as the critical source of nutrition and food security by the community. They were hidden in the best hiding places and fed both infants and older children. So this really highlights the need for guidance, because at times this was not done because there were concerns about safety or not knowing how to support it properly. Next slide, please. I will move more quickly. I've noticed the time. The rapid evidence review also confirmed that all forms of breast milk feeding are safer than BMS. And in most situations, specifically, wet nursing is safer and more beneficial than BMS, especially in emergencies. We do acknowledge the limitations. This was a rapid review that focused on existing narrative or systematic reviews, and a more robust and in-depth review is recommended in the future. Next slide, please. So that was a bit of background. And now there are just two or three slides on the guidance, just to introduce you. The guidance provides technical and practical advice on why, when, where, and how to support wet nursing. And it's primarily intended for emergency response, but it also applies in non-emergency settings to enhance resilience and preparedness. And it really aims to systematically increase access to breastfeeding for infants and young children by normalizing the use of another healthy lactating woman to feed an infant in need, and by guiding at-scale support for wet nursing. But it can also be used for individual case management. It focuses on situations which are typically encountered in emergencies, within which wet nursing is considered urgent and important for child survival, recognizing that there are many different reasons why wet nursing occurs. And lastly, we define wet nursing as an altruistic practice and a compassionate act, not as a commercial occupation. You can see the audience below. And here just to say that there are different chapters which speak to different audience members. Next slide, please. Some of the questions that it sets out to answer are the ones that we have commonly encountered. What exactly is a wet nurse? Who can be a wet nurse? Can a grandmother be a wet nurse? And how might we find a wet nurse? And if we found a potential wet nurse, how can we maximize the chances of success and minimize risks? Does that involve screening? What should we screen for? So you'll find guidance on all of that in the upcoming document. Next slide, please. So lastly, just to give you a top-line overview of the guidance, as I mentioned, different chapters speak to different audience members. There is guidance in there for IYCF counselors and other frontline workers on really how to establish wet nursing and get it set up for success. And on the right-hand side, you'll really see how in what detail we go. Providing a step-by-step process from identifying the need for wet nursing for an individual infant to supporting an informed decision-making process, to initial counseling to really maximize the chance of success, to minimize risk, including through referrals to other sectors, and then continuing to support through monitoring and follow-up and ongoing skills support. That is the guidance. Screening was an absolutely key issue that came up. And so for that, a complementary screening tool was developed by Save the Children. I'm going to hand over to Fatmata to tell you more about that. Thank you, everyone.
Thank you so much, Isabel. That was really brilliant. Next slide, please. So in the interest of time, I'm just going to point out that be expecting this tool, which was developed with TAG of specialists and frontline colleagues from the IFE core group, as well as women-led organizations. This was led by Save the Children, and it has been piloted in 3 countries, Nigeria, Bangladesh, and Somalia. And then the feedback that has been received so far is being used to finalize the tool. The final tool is expected by the end of May. Next slide, please. So in terms of next steps, quickly, I'm sure you're all excited and want to see what next is there with the guidance. We will finalize and disseminate this guidance by the end of Q2. And then Save the Children, as well as TAG members, will also work on finalizing the screening tool, which is a complementary tool to support the implementation of the guidance, especially with screening. And then in terms of knowledge gaps, so far, we have identified, as Isabel mentioned, desk review conducted by Isabel and the rapid evidence review, which was conducted by Bindi and Alex, thanks to you. But given the deeply rooted issues, religious beliefs and socio-economic, cultural issues around infant feeding, especially wet nursing, we acknowledge the need for further research, and we hope that partners will take this up and support more evidence review as well as research around the subject. And then we will continue to talk, converse about the terminology. As Isabel has already explained where we are on this, we will continue to advance on this. Next slide, please. Then we definitely encourage you to use the case studies to populate experiences across the world. Then we will not complete this without thanking all of you that have contributed to this amazing piece of work. On behalf of UNICEF, we would like to acknowledge TAG members who have worked on this relentlessly, the IFE core group, as well as individuals who have provided technical guidance and contribution to developing this guidance. We say a big thank you and a big vote to all of you. Next slide, please. That's the last one. So I think that's it for us. We invite you for any thoughts, questions, and thank you so much for your participation and listening to us. Thank you.
Thank you very much, Fatmata and Isabel, for this rich presentation. And I think we will now hand over to Ines Fernandez from Arugan.
Thank you so much. Good evening in Manila and good day in many countries watching now. We would like to thank the opportunity for us to share our wet nursing experiences in the Philippines. Next slide, please. Next slide. You would see the turbulent typhoons that happened in the Philippines, and every year we experience 27 typhoons. And you can see on the photo the devastation. But you will look at the tent, an imported tent that was donated. We were thankful, but it was so pitiful because it's not appropriate to a tropical country where after a very strong typhoon, there are intermittent storms that follow in the evening. And this tent becomes a waterbed. As a consequence, the children, the babies became sickly with respiratory ailments. Next slide, please. Next slide. The mud floods of this disastrous typhoon is also very dangerous, especially for women with children. And anyone who fell on the mud flood could not recover and get up. Next slide, please. The Arugaan Best Team, we are 50 on call, ever ready at any time for emergency rescue. And WHO funded our project, Breastfeeding Response, to 2 islands that were really devastated and ravaged, and nothing was left in that land except a few of the residents. And WHO told us that there are 40 pregnant women to save based on the study, but there we didn't find a pregnant woman because they were the first one who was washed away by the tidal waves. And we brought our paraphernalia, the kitchenwares, and our marketed food because there is nothing to feed except ultra-processed foods, which doesn't help. Next slide, please. And we cook at 3 a.m. to feed 500 moms with babies and children every day. Next slide, please. In this slide, you can see that we don't only feed the moms and the babies, before this slide, please, but we also teach food that heals and nourishes. Why it is important to use indigenous foods, because it helps with their health, especially during emergency. We teach A to Z food literacy. Next slide, please. We set up, next slide, please. We set up simultaneous tents. Next slide. We set up simultaneous tents with big tarpaulin photos on as visual aids in local dialects, and so that the passers-by can see. Can you come back, please, to the last slide? Because in that simultaneous tent, we encounter a mom. Before this slide, please. Okay. We encounter a grandmother and a mother with a toddler and a baby bottle feeding with formula milk. And during the breastfeeding counseling session, we asked the lady beside the mom if you can allow to breastfeed the baby who's never been breastfeeding to wet nurse. And she obliged. And then we put back the baby to the biological mom, and we ask for express donor's milk, and we do the drip drop while the baby started initiating breastfeeding. Next slide, please. In the next slide, we encounter a bottle feeding moms, and she attended our breastfeeding counseling session in a cluster group, and we do the lactation massage so that everybody will learn the step-by-step. When we leave, they can do it. And we ask for donor's breast milk for the drip drop during the initiation of breastfeeding when the mom and baby are ready. And on the other tent, we gather the community health workers, volunteers, mostly grandmas. And we told them that you can breastfeed. They attended the counseling session, and then we do it live on the grandma, how to do the relactation management. Next slide, please. During home visits in these flooded areas, we bring along visual aids, colorful in their local language captions, so that the mom can understand. And most of the survivors of the typhoon, they're absent-minded. Their minds are fleeting. They're so worried. There are missing members of the family, and they have nothing left. So, and they don't know how to rebuild. So that is the main concern for, especially for humanitarian service. Next slide, please. We intervened, we applied cross-nursing intervention to two neighbors, cousins. One is breastfeeding and the other is formula milk feeding. So we immediately do the switch nursing, give the newly born breastfeeding baby to her for the latch, and the other mom, who is an experienced breastfeeding, gave the bottle feeding baby on her. And we do the lactation massage step by step, and do at the same time counseling her on the breastfeeding why and the risk of formula milk feeding. And then when the mom and baby are ready, we do the drip drop of donor's breast milk, and it is a successful breastfeeding journey. Next slide, please. In the next slide, we encountered baby crying on bottle with water, and the baby was left with a neighbor because the mom went on a rice ration, so she was on queue line, and the baby was left to this neighbor, and our wet nurse gave her a wet nurser, our breastfeeding counselor, wet nurser, and the mom came, and they both were so grateful when we were explaining why it is necessary. Next slide, please. Adaptive breastfeeding. At the evacuation center, the mom has a baby, but it is an orphan. It was the the baby of a mom of her sister who passed away in the evacuation center. So she adopted the baby, and we showed her how our wet nurse will do the breastfeeding positioning, the proper latch on, while counseling her. And she obliged to have her lactation massage, and we attended to her induced lactation. Next slide, please. A 8-month-old malnourished baby, never breastfed. Our wet nurse nursed the baby, and in the afternoon we give donor's breast milk for the transition to be given through cup feeding, and the following day we followed her lactation management. Next slide, please. In our mother's classes at the school grounds where the evacuation centers are, we show how to do the proper positioning with the wet nurse, and we also applied lactation massage while counseling. Next slide, please. In this photo, the fathers asked us to help them teach how to do lactation massage because their wives or factory workers were bottle feeding, and when they arrive in the evening, their daily wage is not sufficient for the family needs. And so next day they brought their wives, and they do well remarkably, and they save a lot of money. Next slide, please. Hand expression is taught. We never use the palm. We use the power of our body, and we also give express breast milk as donors breast milk for the toddlers. Next slide, please. And through cup feeding. This is the most powerful, efficient, effective Arugaan way of managing cross nursing, wet nursing, and relactation and induced lactation. The mom in red wished to breastfeed, so she borrowed the baby from the mom who is expressing her breast milk so that she can wet nurse, while her baby, who is bottle feeding, was wet nursed by the lady in blue blouse. And her baby is being taken care of the other mom. So 1, 2, 3, 4, 5 is the most effective way in less than an hour for this wet nursing and relactation. Next, please. Grandma, yes, you can breastfeed. And grandma was so shocked when she woke up. She had the twins grandchild left by her daughter, and she called for help at the health center for formula milk, but we were there. So in 30 minutes, her breastfeeding hormones was released, and it was successful. Next slide, please. The most touching is the center, the sanctuary for abused babies and children. They were being sold at the bus station. We found them in the dog cage house. They were physically abused. And so the owner, who is an environmentalist leader, asked our mother support group to send them 8 wet nurses for the late time, and 8 wet nurses for the evening. And they were paid well. And the baby were recovered, were nurtured, and are now so healthy that they were adopted by wealthy families. Next slide, please. Next slide. The next slide is you will meet. Next slide, you will meet our heroine wet nurses. They were 16, and they brought along their biological babies while wet nursing the emaciated malnourished babies at the Bantay Bata Center Child Watch. Next slide, please. In our Arugaan daycare, we have wet nurses. Next slide. We have wet nurses staff in support of working women. We operate our creche from 7 a.m. to 7 p.m. Monday to Friday to support working women who are breastfeeding in the evening. Next slide, please. And next slide. I walk the talk. And you see, wet nursing is inscribed in the Philippine laws. So let us not blame and shame the mom. Let us tap our natural wealth, our breast milk, our human milk. Next slide, please. I walk the talk, and at 60 years old, in the next slide, you will see me wet nursing. Next slide. This is me. At 62, I wet nurse a 1-year-old baby. At 64, I wet nurse a 2 months-old baby enrolled in our daycare because our wet nurses were absent. So we took over in that powerful role of wet nursing. Thank you. Maraming salamat.
Thank you, Inez. That's so inspiring. It's wonderful to hear about your work. Can I check? Can everybody hear me fine?
Thank you, Bindi.
So we're going to move now into 30 minutes of interactive session. And this is the time where we want to hear your experience and your ideas. We're going to be using Menti polls and short responses, and you can respond in the language that you prefer. You can respond in English, Arabic, French, or Spanish. To use the Mentimeter, you can visit the link in the chat. So go to the chat and you'll see the link. You can use that on any browser, computer, tablet, phone. If you can't access the chat, you can visit menti.com. That's MENTI.com. And you can use the code for today's call. The code is 87998650. That's 87998650. Or you can also use the QR code on the screen. So if everybody's ready, our first question is there on the screen now. We'd like to know, do you have experience in supporting wet nursing in your context? The answers are yes or no. Please go ahead and let us know. The translation of that question is in the chat box in Arabic, French, and Spanish. So if you need to, look there. At this stage, I can see that more people are saying no, that they don't have experience. But an impressive number of people are saying yes, they have experience supporting wet nursing in their context. And those numbers are growing. Still about twice as many people haven't had experience, but a very impressive number of people have had experience. So very exciting that we've seen Inez's inspiring examples, and that the wet nursing guidance is going to be here to help us with supporting wet nursing in our context. In the interests of time, we'll move on to the next question that we have. So in 2020, there was a review of 25 countries, and they found no wet nursing regulations or guidance. Inez has told us that there is guidance in her setting in the Philippines. So we're asking our second question, which is, are there any policies that regulate wet nursing in your setting? You can answer yes, no, or don't know, and you can look at the translation of the question in Arabic, French, or Spanish in the box, and the answers are lovely coming in. Very impressive. 7, 8 people, 9 are saying that they do have policies that regulate wet nursing in their settings. The majority of respondents are telling us that they don't have policies, and a lot of people don't know. So that's some homework for all of us to do when we get back home or when we get off the call, to take a look in our setting and see if there are policies. And once again, the wet nursing guidance is going to be very helpful as a starting point for developing policy. I must say I'm very impressed with that 12 respondents who have policies in their settings. Great. Let's move on to our next question and point, which is about programming. So other than the absolutely amazing experience that Inez has shared with us, the Aragon experience. There are very few examples of programs that support wet nursing at any scale. We've certainly heard isolated examples of wet nursing practice spontaneously. Many of us have heard about the Chinese policewoman who was breastfeeding her own child and then wet nursed a number of babies who were separated during the 2008 earthquake in China. Some of you may have heard of a refugee camp staff person who wet nursed a malnourished baby that came into the camp. And some of us have even seen grandmothers or aunties wet nursing grandchildren, nieces or nephews. But there are very few examples of programs at any scale. So the question here is, are there any programs in your setting that support wet nursing? Again, translations are in the chat box. I am actually quite impressed to see an 15, so what percentage, I'm not sure what percentage that is, but 15 respondents are telling us that they have programs that support wet nursing in their settings. Once again, not surprising to see that most respondents don't have programs supporting wet nursing in their settings, and some of us, again, don't know. So I'm still really very impressed there that now 16 respondents have said there are programs supporting wet nursing in their setting. And again, the wet nursing guidance will be a great help to us in designing and setting up programs to support wet nursing in our setting. So great, we've gotten a feel, we've taken the temperature for the experience in the group. Now we're going to move on to some more open-ended questions to learn about your thoughts and experience. And you can answer with short texts to these. So the question here is, do you think that you can support wet nursing in your context? And if yes, why? What are the facilitators, the things that will help you? And if no, why not? What are the things that will make it difficult? Once again, the translation is in the chat box. You can answer in your preferred language. You can make a short answer saying yes because, no because, and we will have a chance to translate some of those. So we're seeing here that there is cultural acceptability and social norms for for wet nursing in some settings. Some people say that it could help into that religious considerations make it easy or difficult. There are a few responses talking about openness to wet nursing, trying to incorporate it into program design or counselling. I see some people are saying that they need to learn from the experience of others. I'm seeing too that some people feel that are focused on the relationships between wet nurses and caregivers or families of infants. And it's really nice to see that positive response. Wet nursing works, absolutely. Someone has told us that they teach about milk sharing in their setting. There's a little bit of response around lack of guidance until now, training, the need for training. Can we see any responses there in French, Spanish or English yet? None in Arabic so far. One person is telling us that their country is disaster prone and that wet nursing will be really helpful. Religion, or particularly milk siblingship, I think this refers to, is making it easier or harder. So in settings we have even the same factors that can be facilitators or barriers. One person here is talking about criminalization of contamination or disease, and that's certainly in some settings a risk and something that needs to be thought about. We're seeing there that we need to get governments on board. Again, donor milk policies around pasteurization or not. So there are some existing regulations and protocols in some settings that make it easier or harder. Seeing there that there needs to be some discussion with professional bodies and ministries of health. Are there any answers that have come in Spanish or French or Arabic yet that we would like to see? Yes, I'm seeing that one answer is that yes, it's possible. Please go ahead, Peggy.
Yeah, sorry. Just one responding very enthusiastically that this is a fantastic option to infant formula feeding. Yeah.
Excellent. And I see one response in French. There's the related to risk of transmission of disease. That is something that definitely needs to be considered in any programs related to wet nursing. Okay, look, we've got some wonderful answers there, and we are going to be collating those answers and learning from your thoughts and experience. But in the interests of time, let's move on to our next question. Our next question is related. What do you think is needed so that wet nursing can be supported in your context? So our next question is, what do you think is needed so that wet nursing can be supported in your context? Once again, you will see the translation in the chat box. You can answer in any language. And it's fine to say, I don't know. Short answers, we need this or that, or I don't know. So I'm not seeing responses coming up there yet. Think is needed. And some very interesting responses around education awareness, endorsement of health boards, policy and support that goes down to frontline health workers. There are things related to safety, which I suspect is comments on disease there. Changes in social attitude. There's one very personal, and I think this relates to breastfeeding too, prioritization of looks over baby's health. There are an very interesting comment around educating journalists, which also applies to breastfeeding, capacity strengthening, normalization of wet nursing. We need research, that's for sure. We're getting some really exciting responses in there. Have any come through in French or Arabic or Spanish at those of you who are speaking those languages? I see
Bindi.
approval by professional health associations. Yes, please go ahead.
Bindi, this is Dima here. I could see you in a response in Arabic, but that was in the chat to that question, saying that basically supporting the wet nursing mother with appropriate infant and young child feeding practices and the recommendations. So to meet those recommendations and also to take into consideration her nutrition as well. And yeah. with her her well-being from a nutrition perspective.
And then Cecile, would you like to tell us about the French response that I can see there?
Sorry, can you scroll? Sorry, I lost track. Yes, this one. So this is a complex one. This is a situation whereby babies would be considered as brothers and sisters. And there would be implications on sorry, I'm blanking on the translation here. Yeah, so there are implications, big implications.
I can help with that, Cecile.
Take into account.
Excellent. Yes, and that I think refers to milk siblingship. We need, if I'm understanding this response correctly, we need good records of wet nursing in those settings where concepts of milk siblingship exist. So the idea that if a woman wet nurses a child that is not her own, that child becomes her child and therefore becomes a sibling to her children, and those children then can't marry. So we need records of milk siblingship to ensure that no inappropriate, I guess, marriages take place. Thank you for that response. That's really important. Are there any responses in Spanish, Peggy, that you would like to highlight?
Okay, just one emphasizing the importance of education and the social acceptability of the practice around the social acceptability and access to tests related to the making sure that the child, the mother and the wet nursing woman is healthy.
Thank you, Peggy. And Dima, I see a couple more Arabic responses. Can you tell us about those ones?
Yes, so briefly, if I can summarize it, is more about the need for capacity building so that this can be supported, working on behavior change as well, nutrition behavior change, and also on cultural norms that that basically are related to the issue of the relations between children who have, the siblingship that the milk siblingship, if I get that right in English, and yes, and basically documentation as well. So having a system where this could be documented, and having the wet nursing, documented, and the children as well who would have been wet nursed. I hope I did that.
Fantastic. Thank you, Dima. And I see, Pushpa, in the chat, you have asked a question about milk siblingship. Would you kindly pop that question in the Q&A, because there will be someone who can respond to that in the Q&A. Someone has pointed out the importance of images and being very careful with our images around wet nursing or breastfeeding. We got some fantastic responses there, almost 100. Let's move ahead to our last question. And this is the cracker. This is the one that is really, I think, the most important question. You've joined today because you're interested in wet nursing. You've talked about your familiarity with it. You've talked about the barriers and the facilitators and what's needed. And now we want to know, what can you personally do to support wet nursing in your context? The question is in the chat box. You can write in any language. This is our call to action. We don't want this to be another webinar that you spend an hour and a half on and forget. We want you to do something. What are you going to do? What's your commitment, however big or small, to support wet nursing in your context? And one person, I think it's a few people are saying, we just need to keep talking about it and counseling about it and encouraging mothers to do it and highlighting and normalizing it. Some people have talked about being champions and advocates. Others are writing there that they need to build capacity and to coordinate. A very lovely answer there, educating health professionals and also journalists who can be our friends but can also make it difficult to do our work in wet nursing and breastfeeding. Incorporate wet nursing into training. Lovely, lovely personal action there. Be ready to relactate or to be a wet nurse. That's great. Remove the barriers. Dima, I see a response in
Yes, Bindi.
Arabic there. Could you tell us what that
Yes,
is?
the respondent is saying, I will do everything I can in my capacity.
Excellent. There's another response coming up, Dima. We'll call on you in a moment. I see a response in French that says to raise awareness with caregivers. Cecile, can you tell me
Yes, I've spotted
just exactly what that means?
This one is about
French response.
Yeah, this one here is about possibly evaluating any risks attached to wet nursing, and very likely it is overestimated. So in areas expected to be affected by a shock or a crisis, evaluation could be done.
Excellent. And I think that respondent is confirming what Fatmata said in her presentation, that we need to be careful about overestimating the risks. So thank you for that. I see some more Arabic responses and one Spanish. Peggy, would you like to tell us about that response?
There's someone mentioning that they would like, they think we should be sharing with mothers so that they understand or know about the option. And this person is planning to educate themselves more about the theme so that they can better support in the future.
Fantastic. And I see some excellent thoughts on approaching government submissions. I see one about a milk center in Malaysia. I see people asking for case studies and pilot studies to use as guidance. I definitely see some people saying this is a French response to get it into national policy. I see some people talking about social media as a way to disseminate knowledge on wet nursing. Dima, are there any of the Arabic responses that you would like to highlight?
Yes, Bindi, there was one earlier saying that continuing the conversation around wet nursing is important and something that they are willing to do, and also to convince basically more people, as well as building the capacity and the context. So.
Excellent. And I'm seeing a response there about comparing the risks of wet nursing and breast milk substitutes. And I'm linking that to educating medical students and medical professionals about the risks and benefits of wet nursing or breast milk substitutes. So having that clear and open conversation and emphasizing the risks of breast milk substitutes, especially in emergency situations. I've seen a couple of responses around working women and needing to express breast milk, and that wet nursing could be helpful in their settings. Cecile, Dima, Peggy, are there any other English, Spanish, French, or Arabic responses that you would like to highlight before we close up?
Maybe just one additional in French, suggesting that it's good to have international global guidance. It will ease the process of having them adopted at country level.
And in terms of Arabic, we've also received other comments around basically more seminars and humanitarian work on the importance of breast milk and the dangers of breast milk substitutes and the risks around breast milk substitutes, as well as another one on giving cultural importance and value for wet nurses.
Fantastic. Peggy?
Yeah, just a couple, again, emphasizing the importance of training health professionals and informing medical staff in hospitals, working in emergency settings, just to establish protocols and provide reference documents and support.
Wonderful. 74 wonderful responses and inspiring responses. These are meaningful commitments, and they're your commitments. So that's how I'd like to end up here, by reminding you that if you made a response in this section, that's your commitment. That's our call to action to you. We would love to hear how you follow up on your commitment and how it goes, because this is all part of our learning and working together to make wet nursing, especially in emergencies, a reality. We'll be putting these responses together and making them available and sharing them back. So thank you so much for this great interaction in this session. There are almost 200 participants, and I think we did a great job of sharing with each other our experiences and our ideas. So now I'm going to hand over to Dima and Peggy for the question and answer section.
Thank you very much, Bindi, and to everyone for your contribution and engagement. That was very interesting. We do have quite a few questions that we could ask our speakers. Peggy, would you like to go ahead and ask the first question? I'm not... Peggy?
Yes, sorry. So a question came in about actually about the risk of freeze-dried breast milk requiring about whether it's appropriate to consider. Is that something Bindi might answer?
Sure. So the question was about whether it's possible to use freeze-dried breast milk. And as a brief answer, I think we can say that freeze-dried breast milk requires reconstitution, and therefore it has the same challenges and risks as formula milk powder, especially in an emergency setting. And I would add to that wet nursing and breastfeeding is also more than that. We know it's more than that. We know that it has benefits to infant health and development that beyond the protection from infection. So my short answer would be that if I was choosing between the option of freeze-dried breast milk and wet nursing, in most cases, all things being equal, I would go with wet nursing. Thank you.
Thanks, Bindi. Okay, there's another one from an anonymous participant. What do we do if we see that wet nursing is already occurring without facilitation? Isabel, is that something you might answer?
Yes, sure, I can give it a shot. So this happens a lot, that wet nursing is occurring spontaneously when we see a baby in need. The most important thing, I think, is to step out of the way if we are not properly equipped and capacitated. It is very often unfounded fears that undermine breast and wet nursing and discourage it unnecessarily. So the first thing is just do no harm. And then if you are equipped to support, then you could see what might be needed. For example, especially in an emergency, families might not have access to the usual sort of screening methods that they would use. So you could help facilitate that, for example, or offer counseling. Really just seeing what is needed, very similar to any other breastfeeding counseling support. Thank you.
Thank you, Isabel.
Thanks, Isabel. Yes, we also had a question from someone anonymous, and that possibly maybe Fatmata or Isabel may be well placed to answer. So, as a health promotion program, like in health promotion programs, how would wet nursing programs be evaluated?
Yeah, I can take that. Thank you so much, Dima. I think, as in any other program, wet nursing needs to be evaluated. It can be a standalone program, or it can be integrated into existing evaluations. This all depends on the benchmark, the indicators that are set out at the beginning of the program to assess quality of program, success, progress, and challenges. So I will fully endorse here that it's important to be evaluated, but also depending on the benchmark indicators that are being used, and also important to consider whether this can be integrated into existing infant and young child feeding programs, or a vertical program that is being run by partners, as in most cases. This is what we see happening in the field. But it's the onus also of governments to take the lead in all of this. And if governments take on a large-scale evaluation of infant and young child feeding programs, I mean, wet nursing should also be integrated. Thank you.
Thank you, Fatmata. Peggy.
Okay, great. I think this question may be for Inez. A couple of related questions came in from Brooke and Stephanie. One was about for the grandma that was able to nurse her twin grandchildren. Did she have previous breastfeeding experience? And also related to the grandma, how long does it actually take to relactate? Could you go into a little detail on that? Or were you already lactating? And this person shared that they haven't nursed in 14 years, but still get drops of milk in the shower.
Thank you. Yes. With the mom who was relactated with the twins was breastfeeding her previous children, but on mixed feeding. And that was a big gap already. But because of emergency situation and her determination, when we persuade her of the importance, and it was survival. It's a matter of survival. So in 30 minutes, we were able to bring her back. But in normal times, when we do relactation with grandmas, at any age, there is no age barrier. In some cases, it took us like 5 days only. But because we have we borrowed a baby below 6 months so she can wet nurse during that relactation management. And usually what we do is the cross-nursing intervention. So that is how long will it take. It depends also on the person's determination. But again, It sometimes just 5 days or 3 days, or in that instance, because it was emergency, it's just a day. Thank you.
Thank you very much, Ines. Our next question. So someone asked in terms of the wet nursing guidance. So will these be provided, how and when? And also someone said, you know, it's something we really need, and a PowerPoint presentation outlining the guidance would be useful for dissemination purposes. And someone also saying, you know, a template for case studies, could it be provided? So I think that question will go to UNICEF, Isabel or Fatmata.
Yes, I can just take it up from there. So the guidance is still being finalized. We are expecting to disseminate this by the end of Q2 latest. So once it's ready, there will be links provided to the guidance and will be widely shared for people to access and use it. And like I mentioned in my presentation, there is a case study template, and we encourage partners to use this template to document experiences around, you know, wet nursing in emergency settings. So look forward to it. We will make sure that the broadcast goes out to through the IFE core group and our other UNICEF channels, so you can all access and use it. Thank you. Isabel, please add on.
Sounds good. Thank you.
Okay, there's another question that seems to be directed to Inez. So I'd like Inez to respond, but if Fatmata or Isabel would like to add, that would be great. It's a question about screening tests for potential candidates who can wet nurse. And the question for Inez is, are there any screening tests that are actually conducted for the wet nurses in the Philippines? Thank you.
During emergency, since it's calamity, no resources, we just do our best to give no harm. And breastfeeding is not contaminated, is safe. So we do the wet nursing. And of course, we are mindful of signs and symptoms of an illnesses. We don't give the baby to a wet nurse who is sick, very sick. Of course, you give to at least a normal mom, where we can see the signs and symptoms that they're okay. And so we don't, it is impossible to have a medical test. But on normal times, we may have the chance to do the test. But again, it is a gender fairness. We should ask both the mom, if a mom needs to be relactated, two families should be tested. And besides, there are very few contraindications to breastfeeding. So maybe you may be thinking of communicable disease, but maybe it will not affect the breast. It will not, but it may affect the baby. But again, if we have, during normal times, we have medical facilities. And that is where the guidelines would come in. But during emergency, the calamities, let us not medicalize, because it is impossible. Thank you.
I'm happy to also add a little bit on this from the guidance, which is that it is very context dependent. So as my Ines has shared, in her context, it's really impossible to conduct testing. In general, for a screening, we want to consider the most serious and the most prevalent risks. So that involves testing, if possible, or screening for prevalent infectious diseases, which have a proven high risk of severe illness and death in infants, and there is evidence of transmission through close contact or through breast milk / breastfeeding. So there for any emerging infectious diseases, you'd want to consult WHO for the latest recommendations, which might justify temporary avoidance of breastfeeding and screen for that in certain situations, certain infectious disease outbreaks. But again, it's really context dependent. It would depend on the infectious disease profile of the context, what the national policies and guidelines are saying, making sure, of course, also that they're adequately taking emergency considerations into account, and what is the actual capacity for testing and treatment. We don't just want to test and then not be able to respond if problems are detected. So the guidance covers various different screening methods, which could range from an open and honest conversation about lifestyle and a self-exclusion questionnaire, to doing a physical examination for signs and symptoms, or even laboratory tests. This really varies depending on where we are. So the guidance will cover that. And then the screening tool, which Fatmata mentioned, which is being developed by Save the Children, will provide a very practical tool to help with the implementation of the guidance around screening. Thank you.
Thank you so much,
very
Inez
much.
and Isabel. Thank you.
Thank you. That's right. Thank you very much. And we can see that more questions are coming in. And for all those that have not been answered, we will put those answers together and share them with a webinar package with everyone who has attended. So it's time to go to the closing and evaluation, handing over to Cécile.
Thank you, Dima. Thank you, everyone. I hope you enjoyed this webinar as much as I did. Thank you for your active participation. Before you go, please know that when you will leave this Zoom webinar, there will be a window popping up for you to give us feedback. It's very important we hear from you on how did that go. Also, I want to thank all the speakers and facilitators. Everyone, please know that there is also the GNC website you can use to request support or ask any question you may have. And with that, I think, thank you, everyone. And have a good rest of the day. Bye-bye.